On this upcoming episode of Rock Solid, I am so excited to have on Dr. Eris, who holds a doctorate degree in marriage and family therapy, and she holds a master's degree in counseling psychology. Dr. Eris says that her greatest desire is for you to take control of your life and find your strength, your voice. No matter what has come before, she says you can create the life you want to live and become your best self. What better time to dive into this than right now, in the midst of a world pandemic where experts are saying the mental health effects of COVID-19 on the general population is looking to be profound and long-lasting and deserves some serious attention. This podcast episode is your no panic guide to daily life and the new and changing COVID-19 world. Listen for invaluable mental health tips for yourself and for loved ones, and find out about free mental health programs Dr. Eris is now offering. This includes a free 5-day anxiety workshop program, and she's holding right now free online private groups where you can connect with her directly and live to support you during these extra stressful times. She owns a company called Face It, which we will talk about on this show, and she has a counseling center here in Los Angeles. It's called Second Chances, where she has a huge team of mental health experts where they help mend unresolved issues, which can lead to rocky relationships, family issues, and many more serious disorders. Dr. Eris and her team help fight against such things as anxiety, depression, alcoholism, drug addiction, eating disorders, and many others. She's the author of Breakup Emergency, a guide to transform your breakup into a breakthrough. She's also known as the Divorce Doctor. She founded her company, The Divorce Doctor, to help clients have a better marriage or a better divorce while becoming better parents. Yes, this doctor is also a wife, mom, and of course, a dear, dear friend to me. And once again, I am so excited and honored for you to be able to listen to our conversation. She really excels at giving simple to understand tools that we can all use to help manage our stress, our fear, our anxiety, and be our best, most rock-solid selves, no matter what, even in this crazy, ever-changing world pandemic. Here we go. Hi, everyone. Welcome to Rock Solid with me, Crystal Fambrini, where we understand what expectations are, learn to break through them, get grounded, and live your best life, your most rock solid life, whatever that looks like to you. And today I'm so excited to have another one of my dear friends on. I love bringing on my light workers who I think have beautiful energy inside and they're beautiful on the outside. Dr. Eris, and you may know her from LA Shrinks on Bravo season 1, right? Or you might have listened to her voice with Ryan Seacrest in the morning show. She also has a couple different programs that she's doing. What is your new program that you're doing? I'm so excited about it.
Yeah, so I have a company called Face It, where we're
Yes.
changing the face of mental health, and we are working on different ways to be able to bring mental health to the masses,
Mm-hmm.
in new innovative ways, because technology has changed so much that we can reach out to people, and luckily we're breaking the stigma. So we're creating all sorts of programs online to help people with mental health coaching
Mm-hmm.
and accountability, and online programs that you have that extra support with mental health coaches who have master's degrees in psychology. So it's
Amazing.
really exciting. And I have a free program on Facebook right now. It's a private group, so it has that private sort of no people aren't going to peek in and see what you're doing. And I'm helping people through anxiety and depression and relationship issues, and giving them all sorts of tips, tools, and strategies to help them through, especially during this time, that we're going through right now, where mental health, issues are definitely on the rise.
And not only are you doing that, you're also known as the Divorce Doctor.
I
Uh,
love my, working with couples in the 11th hour, helping them have breakthroughs in their marriage so that they don't have to get divorced.
So there's so much to talk about right now with mental health and COVID-19. People are saying, at least on the media and with my research and just talking to friends, that America and possibly the world is in a mental health crisis right now. What do you think about that?
I mean, we are in a mental health crisis.
Uh,
I was telling one of my patients yesterday, I was like, you're talking about your anxiety because of all of the unknown, right? There's so much
mhm.
unknown, and anxiety is heightened. It is, stems from the unknown and future thinking and not knowing what's going to happen in the future. And you're predicting everything that's not right here in the here and now. And I told her, I was like, look, I'm a therapist, and it's like one time in history right now where the therapists are experiencing the same thing as the patients are. So we understand and can empathize on a whole new level, just when we're talking about just the regular anxiety that I think we're feeling globally, right? And then you have the added pressures of job loss, with unemployment being on the rise, and the pending, depression and recession that we're going into, and all of the unknown of what's happening, and people are dying, and people are losing family members. They can't even go to the hospitals to visit the family members dying. So many things are happening, and it's really, really sad. And then of course there is, the polarizing viewpoints of what's going on that's adding to the stressors that people are experiencing.
There's so much fear, and a lot of people use the acronym. Fear is false evidence appearing real.
Yes. So and there's fear with the false, I use that all the time, with the false evidence appearing real, but I also like to look at the realities of what's happening. And
Right.
for a lot of people right now, I think that this is a big thing, especially what we're doing with Face It, is that, we can't lighten the load of what's happening. I can't fix it, but I can give you tools to help you through it. So what I have people do is face it. Let's really take a real look at your current situation in the mirror and look at what's going on with you, and how can we be in the moment right now and work through it, and giving you tools and strategies so that your feelings don't totally take over and turn into panic.
Right. And how important is it for people, for themselves, to face it individually before they, go and talk to a family member or a loved one and try to help them? How important is it to focus on themselves first?
I think number one, I mean, no matter how cliche it sounds, we always say put the mask over yourself first before anyone else. So you have to take care of yourself, of course, before you're taking care of anybody else. This is a big topic that I've been talking about this week, yesterday and today, in my lives and my Face It group, where I talk about, instead of reacting, talking, and assuming, we need to learn to respond, listen, and think. Right? So there's a big difference between responding and reacting. And so we have to take a moment, and I say take 5. When we have big feelings come up in no matter what our situation is, when we have these big emotions and big feelings come up, I think it's important for us to take 5. So what that includes is take 5 minutes, take 5 deep breaths, take 5 walks around the block, get outside for 5 minutes, and just take a moment to find a way to regulate yourself. And of course, you don't want to dump everything on other people, because so many people are going through the same thing, and they might not be able to give you that sound judgment or what they usually would, right? So we want to watch our reactions right now. I think that's super important, but you also want to be able to talk to family members and friends, trusted people, talk to a counselor or coach or somebody if it's really heightened right now. Why not? It's really important for us to be able to have that sounding board, and there's so many levels of where people are right now, so many varying degrees.
That's what I was going to ask, actually. I see a lot of things on, social media, because that's where I'm doing a majority of my interactions. And I see a lot of my friends on their Instagram, posting on their stories like, oh, I'm just sleeping through the day, or I'm sleeping till noon or 2, because what else am I going to do with myself? Is that a form of self-love, or is that a form of going slowly into depression?
Yeah, so I think that you should have a day to sleep till noon,
Mm-hmm.
a day, maybe a Sunday, but we do have to look at this as our new normal. And
Mm-hmm.
it's going to be, our world is shifting, and we don't know what the outcome is going to be. We don't know what it's going to end up looking like. And if we live in that thought process, that's when we're going to have anxiety and depression, right? We have
Mm-hmm.
to live in the here and now. I think it's really important for us to have a schedule
Mm-hmm.
and just show up for our schedule. And it feels awkward to do that,
Right.
especially, when you're like, why? If I don't have anything to do, if I lost my job or my work isn't as busy, like, why not sleep all day? But what does happen is we start spiraling downwards, when we do that. So, starting your day and doing a schedule, it really has helped alleviate any symptoms of anxiety and depression.
Mm-hmm.
Been talking about this all the time in my group and with my patients. So I think that even for me, going through this, I'm used to, prior to this, getting up at 5 a.m. and going to my yoga and exercising, taking my kid to school, coming home, taking a shower, going to work. It was like, that was what my day was. I had to redefine all of that, right? And for the first few weeks, it was really difficult going, what should my day look like? What do I do? It's all over the place. And I'm homeschooling on top of working full time, which is just a whole nother thing.
Wow.
But I decided that I'm going to get up before anybody in the house, just as I always do, because that's me time, right?
Mm-hmm.
And then I take my time to center myself. I do my own mindfulness work. I suggest that people get up in the morning and do a mind dump, which is journaling,
Mm-hmm.
all of those unconscious thoughts and getting them out on paper, and then moving your body for at least 30 minutes a day, because it puts us in a different state of mind.
Mm-hmm.
Right. So these are things that we need to do that are really important. So scheduling your day, you
I want
know.
to talk about that really quickly because my boyfriend, he's an ER doctor. He's been going through a ton of stress, but I also think he's an expert in managing stress because he has decades of experience of going through extreme situations. And whenever I'm stressed out, the first thing he says to me always is, "Have you worked out?" And at first that annoyed me because I was like, "What does that mean?" Like I was like, "Do you think I've gained weight? Why are you saying that?" And he'd always be like, "No, because it helps with your mental health." He's like, he's like, "Go work out and then talk to me." And I've heard that before, but then when a doctor tells you, and you're also a doctor, it's like, yeah, it's not just for your physical looks, it's actually for your body and your mind. I think
It's
it's so
really, it is. Well, there's such a huge, research and science has shown us the mind body connection,
important.
and your gut mind connection. So
Yes.
I think that when I do it, my husband and I created a tool called the Life Iris, a
Mhm.
life lens. And we look at love, work, play, home, mind, body, soul, give. So we look at all of those areas of life because they're very interconnected,
Mhm.
right? So working on your body, making sure that you eat healthy food, which
Mhm.
is good food equals good mind,
Mhm.
and move body. So move your body every day for 30 minutes because it actually does shift the endorphins in your brain and it helps you clear your mind.
Mhm.
And I mean, I can look at myself from days if I'm not working out or if I'm even sick or whatever. Not the reason is that I'm not working out. I definitely don't think as clearly,
Mhm.
so it becomes, if you make yourself do it every day, it's a part of your life. So
Mhm.
if you're not doing that, I would suggest that you just focus on starting to do that one thing in your life every day. And it's
Mhm.
also getting outside.
Mhm.
No matter where you live right now, even if it's walking around the block in a city, wearing your mask, of course, and taking all the precautions that you need. But just getting in nature is really, really helpful. And
Mhm.
and it helps turn that frown upside down. I had a stressful day last week, and instead of just sitting around and watching TV, I said to my family, I said, come on, let's go, and let's go on a quick little hike up in our neighborhood. We're very fortunate that we live in nature. And I was like, wow, just getting outside just lifted my mood instantly in that moment.
Mhm.
So it's so easy not to do it.
Mhm.
It feels easier not to do it, but it's actually harder in the long run for so many reasons. So it's really important for you to move your body.
So that's something that you can do to help yourself and others. Make sure you're being active as an individual each day. And then if you notice your friends are starting to, crack, or they have so much stress, we can suggest lovingly to them, well, have you gone on a walk? Why don't you go on a walk? That is really important.
I talked to one of my clients yesterday, and she had been anxious the prior days. And I'm like, okay, so you told me that your prescription for feeling good is to do yoga. Have you done yoga the past 2 days? Like, no. I'm like, get off the phone right now and do yoga, right? And then she texted me after and she said she feels so much better. And I said, we know that this is your prescription, so you have to just be accountable to yourself. And if you don't want to do it anyway.
I love that. Yeah, because you just said it, this phone, what happens is you get those news alerts, and we're getting news alerts all the time. Like yesterday, I went through the rabbit hole and I found myself having anxiety because I felt like yesterday was yet another huge, crazy news day in Los Angeles, at least, with, the news that we might be at safer at home till August, which is not surprising. But even since I've already in my head thought that, but then when I get the news alerts and I get them from all these different sources, and then I go online on Instagram and all my friends are talking about it and everyone's upset, and that, and you just go down the rabbit hole, next thing you know, you look up and it's been an hour.
Yeah.
It's insane. And during that hour, so much fear and so much anxiety is just building up in your body.
Yeah, so it's really important for us to limit our news intake. Now, I'm not one to say don't intake. And
right.
I'm not that person, because I feel like information is power. So we need to make sure we're looking at reputable news sources and not using our friends or different places, just whatever, not reliable places for our news sources. Let's make sure that we look at the reliable ones. But if we have a tendency towards anxiety or depression, we need to limit it. And I would say to 30 minutes a day, just get the information that you need. And for the rest of the day, do different things for yourself. Stay connected with friends. We need to redefine what socialization is for us right now.
Yes.
And I think it's better to set up a Zoom call or a FaceTime call with our friends and do one a day where you're connecting with somebody. If you live alone, or that if friendships and connection to others is important to you, make sure that you do that, not just like texting all the time. And connecting with others, and maybe turning the music on. That's what we do in our house, because we have a tendency to have the news on all day long, and we're like, you know what, this is driving us crazy. We need to turn it off and put the Sonos on and play some music in the background. It makes us feel better, so definitely limit the news intake,
because this isn't just a couple days or not even a couple weeks. This is what's happening, and there's not a definite end. So rather than waiting for August or waiting for September or waiting for the date, because that makes you feel like you're waiting and you're not doing anything and you might get down on yourself, just more embrace it a bit, or just change your day, adapt.
Yes. Look, we are powerless over people, places, and things. We are powerless over this situation and the outcome of this situation, what's going to happen. And there's also unknown. We don't know. As much as I want to look into my silver ball and tell you, nobody can tell you. Not even the experts can tell you. Look at science and facts and maybe inform us, about the possibilities and probabilities, but they can't. And you know what? You can't. So what do you have control over? You have control over what you do with your day and how you can embrace your current situation, face your situation, and look at, how you can better yourself as a human. Look, like I'm not going to ignore the suffering that's happening right now. There's a lot of sad things happening in this world. And, I have just a huge heartstring to those who experience that. I own a counseling center here in Los Angeles, and we see over 200 patients a week. And a majority of those patients are people on Medi-Cal. Okay. So I understand and feel for these situations that are happening, right?
What you just said, I think, is so important, because a lot of people think that they need to have some sort of fancy insurance in order to go seek a therapist or have professional help. How would you define Medi-Cal?
So Medi-Cal, and this is also really important information, and you can actually call my counseling center.
Yeah.
So if you have any questions regarding Medi-Cal or any kind of insurance, please call my office, 323-547-2662, and talk to my business manager, Priscilla. She's super helpful and knowledgeable in this area. So,
And we'll put this information in the episode notes for those that are listening and watching. Just check on the episode notes and there'll be a pop-up link so you can access this information. And even if you think that you're doing okay and you've always thought about you wanted to see a therapist or you wanted to talk to a counselor, but maybe you're feeling a little guilty about it, like, oh, they're so busy, other people have bigger problems. No, that's just another excuse that you're giving yourself. Still check in. Right? And even if you're feeling solid, still check in. It doesn't hurt. It only helps.
Yeah, that's how I look at it. Look, I mean, I'm a big proponent. I'm a supporter of the solutions. I feel like the more you look at solutions, the bigger the solutions get. The more you focus on the problems, the bigger the problems get. And I also am using this time, like a time like no other, to look at the silver lining of how I can grow and learn through this experience. I mean, whether it's looking at the triggers that are happening to you in parenthood or within your marriage or being single or losing your job or whatever it is, you can take this time and look at the silver lining. I mean, I'm working with people who have gotten fired. I'm working with people who have gotten hired during this time. I'm working with people who've gotten pay cuts. I'm looking at the pending doom of Hollywood and the industry completely changing, because we work with a lot of people in Hollywood, and then so many different varying degrees, but there is a silver lining in this for all of us if we can just dig deep and look for that, and a lot of times a mental health counselor or coach, therapist or coach can help you through that. And we have a lot of online support with that. Even if you don't want therapy, we're creating all sorts of programs. So you should definitely check that out because it's all free.
Yeah, it's free and it'll help you break through that much faster. A lot of people spend days, weeks, months, years just, putting down, ignoring the issue that they're having, thinking that they don't need support. And then when they go and see a doctor such as yourself, I'm sure they have this, oh my gosh, why didn't I come sooner? Why did I waste all that time?
Yeah. Well, look, our motto is let's face it till we make it together. So the sooner you face the issues, if you don't, you're avoiding, right? But avoiding it doesn't make it go away because what you resist persists. So I am a true believer in facing it and working through it so that I can constantly be working on becoming a better version of myself. Right. And that's a lifelong journey.
Right.
So I use, I always have accountability, whether it's a trainer and working out, or when I have that, I do better, or if I have a coach or if I have a therapist, I'm always able to face it and learn and grow, because our reactions or mental health issues, whether it's anxiety or depression or body image or relationship stuff or whatever it is, it's all unconscious stuff that we haven't faced within ourselves. So why not use this time as an opportunity to face it? And also in working with couples, divorce is on the rise. And
I was going to ask you about that. Divorce is on the rise?
Well, divorce is and will be on the rise. Wow. So is baby making, right? So, but we can also use this as an opportunity for our relationships to grow, have the opportunity to work on our unresolved issues within the relationship. Now, because we're in enclosed space, I get it. I'm in enclosed space. It's not an easy ride, stuck with just your family for, over 2 months now.
An extended holiday.
But using this time to work on the things that you get to in your marriage. So I say you get to because, you have to anyway. They're not just going to go away. So if you can find a way, like I was saying earlier, to just respond in a different way, learn how to communicate with each other and work through these things, it's amazing. I'm seeing miracles happen with couples. Wow. Like couples that have come to me even right now and working through affairs.
Wow.
and just saying, okay, we have to use this time to work through it, being very strategic about that because they are in enclosed spaces. I'm really watching some very brave people work through the most challenging times, in their lives, and they're doing it, but they're choosing it. They're choosing to face it and, be able to work through it together, and they're becoming stronger in the end.
Mm-hmm.
And I'm also seeing a lot of people realizing that maybe they don't want to be together, and it's very
Wow.
sad, or people are breaking up, the stressors, people are stressing out,
Mm-hmm.
'cause their financial situations are on the rocks. And, because of the impending doom that's happening, people are not on their best behavior.
Mm-hmm.
And so, unfortunately, people are going through some really difficult times. So, the only thing that you have control over is how you respond to things right now,
Mm-hmm.
and what you do and how you choose to show up, right? That's the only thing that you have control over. So I would really just be focusing on the here and now and what you can look at in the moments that you have right
Mm-hmm.
now.
Right now, not be thinking what's going to happen in 3 months, even if it's good or bad. Really stop that type of behavior and just focus on today. What are you executing today? Who are
Yeah,
you connecting with today?
yeah,
What are you doing to give yourself self-love today?
yeah.
And then go to sleep and do the same thing tomorrow.
Yeah. And I mean, the truth also behind this is if we can find a way to focus on the gratitude of what we
Mm-hmm.
have. Now, I understand that some of us are more fortunate than others,
Mm-hmm.
but even if you're going through unemployment right now, how can you focus on like the gratitude? Like, okay, I'm grateful that I can apply for unemployment.
Mm-hmm. Right.
Grateful that I got through the phone today.
Mm-hmm.
I'm grateful that I can stay in my apartment right now and not be evicted. I'm grateful that I have a family member I can stay with. Whatever it is, that if you can focus on whatever you are able to be grateful for, very important every single day to
Mm-hmm.
write down 5 things you can be grateful for. Because if you can focus on the things you're grateful for, the more those things are going to show up. If you're focusing on all the things you don't have and all the negativity that's going around, all the bad, the doom and gloom that is happening right now, the more you focus on that, the more that's really going to be present in your existence right now.
Mm-hmm. And I really like, we mentioned this before, but I just want to bring it back as we close the conversation, because I think it's really important what you said, that you choose to be informed, but you give yourself a certain amount of time each day to do that. So you are aware of what's happening in the news, but you're not obsessing over it. Because I think that's so important too, because when I hear from people that they're not watching the news at all, I get a bit concerned. It just doesn't feel right to me, because I'm like, well, you shouldn't be shutting it out completely. You should still be aware of what's happening, because every day is changing so quickly, so fast. So I think that's a really important point that you brought up as well.
Yeah, and look at it from reliable news sources. I don't know. I can make a shout out to a woman who's doing an amazing job on Instagram. If you only want to watch 5 minutes a day, what's happening? Jessica Yellen. Have you heard of her?
Mm-hmm. Yeah.
Incredible job.
Yeah.
It's like just a few minutes a day, just know what's going on, know where we're at, see how you can inform yourself. And that's what you have to do. But watch out for the fear that the news is putting into us. You definitely want to watch that, because that's about ratings. I mean, a lot of it's about what they have to be doing right now. So if you have a tendency to go down the rabbit hole, just limit it to a
Mm-hmm.
certain amount, but educate yourself, because information is powerful.
Mm-hmm.
And also, before we do close out, I do want to talk
Yeah.
about mindset, because I think that
Yes.
therapists don't talk enough about mindset, and it's a big focus on what I do. So
Mm-hmm.
I think that there's 4 mindset shifts that we really need to focus on. It's either 4 mindset shifts, but there's two types of mind shifts. It's like you can have a growth mindset where you're willing to grow and focus on how I can grow, or you have like the I'm stuck mindset, where I'm a victim and everything bad is happening around me, right? Well, if
Mm-hmm.
I'm looking forward to the growth mindset, I'm going to look at these 4 elements. If I'm willing to face myself and grow, right? So the one is I need to be true to myself. Okay, I need to be honest with where I'm at in the here and now. Here and now, that's it,
Mm-hmm.
right? And I need to be okay with wherever I am. So accept where I am, be okay with it. Okay. And then the next one is push. I have to have a willingness to push through whatever obstacles are in my way right now. Okay. So I'm going to push through it. I'm going to get through the obstacles no matter what they are. I'm going to face them. And then the last one is word. I'm going to commit to myself to do the work that I need to do to stay in that, to find a way to get to that a-okay state of mind. You know, because there really are 3 levels as I look at it. It's either like, I'm not okay, I'm okay, or I'm a-okay. So I help give people the tools to help them go from wherever they are to an a-okay state of mind, where I can really, you know, just be in the here and now and be present about what's going on and continue to push through any of the obstacles that are in the way and just commit to myself every single day.
Yeah,
You know?
and that sounds so easy. The way that you break it down sounds so elementary, really. But a lot of people just don't have access to this information, or they weren't taught it. I mean, where is the disconnect with us, with human beings, with our education system? I mean, what you just said is so simple and so brilliant. I mean, I wish that they were teaching this in schools consistently and every year, just as a reminder. And hopefully they start.
That's a whole nother subject.
I know, but it's like, you know, this type of information, it's so valuable. So thank you so much for taking the time.
I mean, you know, I mean, that's my mission, is to try and make it tangible and simple, break it down, because what happens is when we suffer from any mental health stuff, our feelings take the best of us. They overtake us, right? That's when we become reactionary. We can't think straight. Right. So I try and like break things down in simple little ways for us. And like my whole thing is like, I'm the therapist that's like, hey, I'm going to throw you the life vest. You're okay. Let me just throw this life vest for you. See if you can like keep your head above water, and let's just take the baby steps, right? It's progress, not perfection. We keep looking at the little baby steps we can take each day. And then hopefully the tools that I've shared today can help you, you know, and come join us in my community. We have a free community on Facebook. You know, follow us on Instagram or Facebook at Hey Face It, HEY Face It. And we have a total free group we're giving tons of tools just to help people, especially during this time, through any mental health stuff they're going through. So.
Yeah, it's a simple name. It makes sense. It's to the point. I love it. I love you. I'm going to join the group just so I can learn more and be reminded. I love consistently being reminded, even if you know all this stuff already. It's just so great to hear it again. And like when you're speaking, I'm like, yes, that's right. Yes, you know.
Well, I want to empower you to get through. I don't want to keep you stuck, because you can do it. I believe in you. Like, I really do. You know, I see so many people that I've been doing this for over almost 20 years.
Yeah.
You know, and I remember once I had, I had a supervisor when I was becoming a therapist. She's like, you're so much more of like a coach. You cheer people on.
Wow.
Yeah, it works.
Yeah.
Like I work with people with trauma, and I still want to cheer them on, because you have to find a way to believe in yourself. And once you can find a way to believe in yourself and commit to you can work, you can make it, you can do it, you can. Trust me.
Love it.
I have worked with people in Compton when I was training to be a therapist, you know, and I want to help you find that silver lining for yourself. Yeah.
Yeah.
So.
And I'm starting to feel emotional right now. Like I'm trying to like, don't cry, don't tear up, because I think what you're doing is so beautiful. And I know that people listening to this, it's really going to help people. And so I just feel such an honor to be able to talk to you, to have my listeners and audience be able to learn from you. And I really think that you're an angel. You know, you're an angel. So thank you so much for, you know, stepping up and helping right now. And not only do you have like an amazing, or, you know, organization, you're doing stuff for free for people online, and you've turned into a teacher recently with your son, and you're a wife, I mean, and a business owner. I mean, there's so much stuff going on. So thank you so much.
Crystal, I don't know if this is going to air but before next week, but we are doing a free 5-day workshop starting on Monday for anxiety.
Okay, perfect. Yes, this will be airing before that.
Okay, yeah, so please join our Face It group. By Mondays, we are doing a 5-day workshop. We're creating a workbook for you guys to help you through any anxiety that you're feeling right now. And yeah, just make sure you answer the 3 questions, because my team won't let you in if you don't answer the 3 questions, because we want to make sure we don't just let anybody come in, because mental health is such a sensitive topic.
And when you talk about a workshop, I think some people might think, oh, I don't have the time for that, but they can't really use that excuse right now. But even so, what does a workshop mean? Like, how long is it? How much are you committing to each day?
You know, I mean, every day we do it live, listen to the replay, listen to
Yeah.
it later, grab your
Awesome.
workbook, do the work on yourself. It's not going to be like hours and hours and hours a day. You know me, I like short, quick tips. That's my style. But I'm going to help you face it till you make it and get through this time and give you some tools, because my whole thing is like, if you're in a better place, more people in the world can be in a better place. And we kind of pass that on, pass that along to the next person.
Yes.
So,
awesome. And then I ask everyone this question. What does rock solid mean to you?
I love that.
Oh,
That's awesome. What's coming first to my mind is I did this best self meditation with my therapist when I was 30 years old. And it was about my future self. I bring this along. I do this with my clients too now, but it's a best self meditation, my future self 20 years from now. And I did it with her about 15 years ago, and rock solid. I envisioned myself as this woman in the middle of the mountain areas where I feel confident within myself and my skin. You know, I'm not people pleasing. I'm doing things because I'm following my value system and being true to myself and being honest with myself. And therefore, you know, I feel more grounded in my own self-esteem. And so that's what it means to me. That woman, I feel like I embody her now. And I'm so grateful that I did, because I didn't when I was younger, you know, and that's something age can do for you and working on yourself and all of that. But that's what it means to me, is just being solid in myself and who I am as a person, and being true to myself and showing up in the best way I can every day. Not perfection, because I'm not perfect. Progress, not perfection.
Awesome. All right. Well, thank you so much, my friend. I love you. Tracy Bregman, she was on last week. She does namaste. That's what we do now. So we can't hug each other. Namaste.
Yes, I know, but virtual hug.
Yes, virtual hug. All right. Bye. Thank you.
You're welcome.